So looking at the systems, we're going to follow the IPA, which is inspect, palpate, percuss, and auscultate. Not, not like the abdomen, we should use the acronym IAP, which is inspect, auscultate, percuss, and palpate. So before that, we're going to get the vital signs, the heart rate, the blood pressure, the temperature, oxygen saturation or respiratory rate, and we're going to rate the pain. Tell me 10 if you feel the pain and 0 if no. So the patient doesn't feel any pain, and now we're going to collect the BMI, the height and weight. So now we're going to wash your hands and put PPE if indicated to prevent the spread of microorganisms or any contamination. So we're going to close the door and the curtains to provide the patient's privacy. So I'm Wensi, your nurse today. I'm going to. So you are Miss Eliza. Today we're going to do the assessment of the head to toe. Is it okay with you? So now we will begin. So we're going to check the head. So it is nice and pink. So it is symmetrical, same size of your body. So we're going to no dropping or abnormal movement or twitching. So we're going to assess your cranial nerve number 7, which is facial expression. So mom, follow me what I'm going to say. So try to smile, frown, and sad. So the patient facial expression follows me correctly. So next we're going to palpate the head and the cranium. So there is no any masses, indentations or skin breakdown. Next we're going to check your hair. Your hair is black, smooth, asymmetry, and no baldness or any lice noted. So if the patient is mobile, check for the black of the head, check for the hair, no manifestations, no abrupt like crowding, alopecia, which is if you are assessing for the males, check also for the bird. So next, we're going to remove the gloves and other PPE. We're going to assess next your temporal artery by palpating it bilaterally. So next, we're going to assess the cranial nerve number 5, which is trigeminal. So we're going to palpate your masseter. Try to clench your feet and the temporal muscle. So, trigeminal is responsible for many things like massification. So, the temporal and the masseter is nice and firm ball. So, try to, I'm going to feel the mandibular joint by clenching your teeth and open your mouth. No grating or clicking noted. So we're going to palpate the sinuses. We're going to put pressure in the maxillary. Yes. Yes. Next, we're going to check your eye. So, looking at the eyelids, sclera, pupil, and conjunctiva. So, we're going to palpate the eyelids. So, there is no swelling and no exudates. So, next, we're going to check the conjunctiva. So, move your eyes. So, down. So, as I observe, your conjunctiva is pinkish. So, if the conjunctiva is pale, there is a possibility that the patient has anemia. So, next we're going to check the eyes. So, there is no strabismus noted since there is no cross eyes where eyes one turn in and out and one is up and down. So there is no anisocoria 2, which is one pupil is small since the pupil is symmetry and measures 3 to 5 millimeters. So next we're going to test the cranial nerve number 3, which is oculomotor, cranial nerve number 4, which is trochlear, and the cranial nerve number 6, which is abducens. So in we're going to test your oculomotor by performing the 6 cardinal field of gaze. So we're going to focus where the directions goes out. So next, the patient's move her eyes coordinated and smoothly. Next, we're going to assess the trochlear nerve by assessing the papillary response. So, focus on the distant, focus on the distant object. So, we're going to dim the room. So, as I observe, the pupils is constricted. Next, we're going to assess the abducens, assess the accommodation. So, the pupils you feel equally round reactive to light accommodation, which is also known as PERLA, PERRLA. Next, we're going to check your ears. So, I'll be inspecting the outside. So, as I observed, there is no any abnormalities. Your ears is symmetrical and no redness or drainage. So, do you feel any pain? Okay. Next, if the sometimes if the patient have long-term gout on the helix of the ear, they may have a tophi or an accumulation of light whitish yellow uric acid crystal on the skin. So next we're going to palpate the ear. So there is no tenderness or any swelling, no lesions or macula. Next, we're going to palpate the mastoid process. So no swelling and redness. Next, we're going to use the otoscope to check for the tympanic membrane. So it is pearly gray and translucent color. So it should be shiny. Then we're going to check for the cranial nerve number 8, which is vestibulocochlear. So I'm going to occlude your one ear, then I have something to whisper, then guess what it is. So pineapple. Laurel. So the patient guessed the word correctly. So next we're going to assess your nose. So do you have any difficulties in breathing? No. So do you have any mucus? So now we're going to inspect your external part of your nose. So it is symmetrical, no swelling or tenderness. Next, we're going to look at the septum. It is deviated and no any drainage is noted. Next, we're going to check the patency of the nose. So we're going to occlude one of your nostrils, then try to breathe it. Next. So the airflow is normal since there is no any abnormalities noted such as polyps. So sometimes patients who had polyps have difficulties in breathing and the airflow. There is the blocking of the airflow. So next we're going to use the pen light and to okay, so no any drainage or redness and polyp noted. Next, we're going to test your cranial nerve number 2, which is the olfactory. So, you're going to guess what I will let you smell. So, close your eyes. So, what's ay, ang balon mo, ano na, amoy mo. Pili, ano pili? Sige na. Ayaw na, hindi na ikat good. Sige na, dito din. Sige. So, the patient gets the stand correctly. So, we're going to check the cranial nerve. So, it is intact. So, we're going to check for the mouth. So, if the patient has a coughing or hacking, you must wear face mask or shields or other PPE. So, now we're going to inspect your lips. So, as I observe, your lips is symmetrical, pink, no sores, and not chapped. So, if there is oxygen saturation, the lips is dusky or blue color. So, we're going to inspect your cranial nerve number 12, which is hypoglossal. So, stick your tongue out. So, side to side. So, the patient does it with ease. So, we're going to inspect the inside of the mouth. So, no lesions inside, sores, and the tongue is moist and pink. So, it is not beefy red like the anemia or not dry crack which is dehydration. So, lift up your tongue. So, no lesions underneath. We're going to look for the gums, cavities, or loose or broken teeth. We're going also to look for the soft palate and the uvula. So, it is normal since there is no any abnormalities seen and your uvula and palate is nice and in the midline. So next we're going to test your cranial nerve number 9, which is the glossopharyngeal. So open your mouth. We're going to the gag reflex. So as I observed, the gag reflex is intact. So next we're going to check the cranial nerve number 10, which is vagus. So which is intact since she can be able to talk without softness. So try to talk. Then the patient can able to swallow something that without any feeling of difficulties. Next, we're going to assess the neck. So we're going to check, extend. So um, we're going to look at the trachea. So it is in the midline and no lesions. Next, we're going to look for any lumps. So no thyroid problems such as goiter. Then next, we're going to test the cranial nerve number 2, which is the accessory nerve. So try to move your head up, down, side, and another side. So there is no problem with the patient according to its accessory nerve. So try to shrug your shoulder. Oh, okay. So the patient shrugged the shoulder against resistance with ease. So we're going to place the neck for about 45 degrees and turn your head side. So look at the jugular vein and look for any jugular vein distension or JVD. Next, we're going to palpate the trachea. So it is confirmed that it is on the midline. No tenderness, no hard lumps. Next, we're going to palpate the lymph nodes. So no tenderness, no lumps or any inflammation. We're going to palpate the preauricular, post-auricular, the occipital, the parotid, the jugulodisgastric, the submandibular, the submental, then the posterior cervical, superficial, deep cervical, and the posterior cervical, then the supraclavicular. So far, no tenderness noted. Next, we're going to palpate the carotid artery. One side at a time. So, we're going to find it next to the groove of the neck, next to the trachea. So, it is nice and no pounding. Same side, same strength too. So next, we're going to auscultate the carotid artery one side at a time. And we're going to listen to the bell of the listen using the bell of the stethoscope. So no swishing sound and no I didn't hear any bruits. So breath in and out. So I didn't hear any bruits. Next, we're going to the upper extremities. So we're going to inspect. So as I observed, there is no lesions, swelling, redness, or any abnormalities in her skin. Next, we're going to check the radial artery. We're going to palpate it. So, um, next, we're going to check the capillary refill. We're going to pinch her nail bed. So, as I observe, it is smooth, not spongy, and pinkish. When I pinch her nail bed, the color regains about 1 to 2 seconds. Next, we're going to check her skin turgor. So, when I pinch it, the the skin goes back to its normal position. Next, we're going to get the range of motion of hands and joints. So, no abnormalities or like osteoarthritis. And do you feel any pain?
No.
So, next we're going to palpate the brachial artery. Then, we should test the muscle strength. So, I'm going to squeeze your fingers. No arthritis or no grading crepitus. Next, we're going to check the drift hold of the arm. So, close your eyes. Then, I'm going to assess the hand and lift upward. So, no lesions, redness, or edema. And we're going to check your chest. So, next, we're going to test your breathing. Then, we're going to auscultate the sounds of the heart in 5 locations in the aorta, tricuspid, pulmonic, tricuspid, and mitral valve. So, um, uh, we're gonna listen to the right sternal border on the second intercostal. Next is the second intercostal space, the aortic, and we're listening to the love dove. So, in the S1 and the S2. So, the S2 is louder in this location. It is where can be found the pulmonic valve on the left sternal border. Then the S1 is going to be the loudest in this location. So an adult should have 60 to 100 beats per minute. So the apical pulse, so we're going to so no murmurs, switching or blowing sounds. Now we will listen to the lung sounds. So no crackles, wheezes, or any friction rub or stridor. First, we're going to listen anteriorly and listen with the diaphragm over the stethoscope. So, we're going to start at the apex of the lungs. The other side. Move down. And space to the intercostal space of the second intercostal of the lobes. So next, take a deep breath, and so compare sides to sides, then move down to the second intercostal space. So this is going to help us to assess the right and left upper lobe as you deep breath in and out, then to the intercostal lobe. Then we're going to assess the right middle lobe and left upper lobe. Okay, listen posteriorly, listen to the apex, and work your way down. Listen to where the scapula and the spine. Compare each sides. We're going to find the C7, which is the vertebral prominence. So, the shoulder blades, and go a little between in the shoulder blades and the spine right in there. So, listen to the right and lower lobes. So next, I'm going to do an assessment of your abdomen by using the AAP acronym, which is inspect, auscultate, palpate, percuss, and palpate. So before that, I'm going to ask you, do you have any stomach issues, urinating pain or discharge?
No.
So do you have any difficulties during your menstrual period?
No.
So now I'm going to inspect your abdomen. So as I observe, your stomach is flat. Smooth, no tenderness or swelling, no lesions noted. Next, I'm going to check your PEG tube. Not red, stomach is rosy pink, not dusky or cyanotic color. Now, I'm going to listen to your bowel sounds in your fourth quadrant. In your lower right quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. So, it is normal since no hyperactive or hypoactive noted. Next, I'm going to listen to your right lower quadrant. And the left lower quadrant. So, it is normal. Again, we're going to listen to your vascular sounds by using the bell of stethoscope. We're going to listen the part of your iliac, femoral, and aorta, and xyloid process above umbilicus. The aorta, renal, femoral, and iliac. So, no blowing, swishing sounds, or no bruits. Next, I'm going to do the light palpation. Okay, no pain and tenderness. Next, I'm going to palpate your right lower quadrant. No rigidity or any lump masses. Next, the deep palpation about 4 to 5 centimeter. So no lumps, masses, or tenderness noted. Next, we're going to palpate again. Okay, it is normal. So next, we're going to assess your lower extremities by inspecting the color. So, your color is tan. The symmetry, so as I observed, it is symmetrical. Then, the hair distributed normally. So, no any masses noted. Next, we're going to check the temperature. So, it is warm and no edema noted. Next, we're going to palpate the anterior. Do you feel any pain? No. Next to the posterior in the popliteal pulse. So, it is normal since the patient doesn't feel any pain. Next, we're going to perform, or we're going to check the Babinski reflex by using the hammer reflex. So, it is negative normal response. Next, we're going to check your back, the symmetry. So, it is symmetrical. We're going to look down to from head to way down. So, it is symmetrical. Next, we're going to check the spinous process using our finger pads. So, it is normal since it is evenly spaced and no tenderness. So, we're looking for any abnormal. So, no abnormalities of moles, lesions, wounds, or any skin breakdown. And no papules or macules noted.